So speaking about nurses, and this is Nurses Week, and my past videos, if you have been keeping up, and you most definitely should be keeping up, I went to Washington, D.C., and in Washington, D.C., we went to the Nurses Take D.C. rally, which was all about, yes, you guessed it, safe patient limits. 77% of nurses across the country all agree that patient limits are unsafe for quality care, for nurses to do their job correctly. But that is 77%. That is not 100%. Although I'm part of that 77%, I do want to make it known that they are nurses, that they are healthcare providers that are not 100% behind this bill. So let me give them their fair shot, and let's put their point of view out there so you just know what's going on. And the nurse we're talking about comes from my home state of Massachusetts. So, the Massachusetts Nurses Association is pushing hard for a law setting minimum staffing levels in hospitals, but at least one local nurse is speaking out against it. That local nurse is Meghan Aldrich, a nurse at Sturdy Memorial Hospital in Attleboro, which, by the way, is where I did my labor and delivery clinical. Love that hospital, fabulous place. She registered her opposition Monday at a public hearing held by Legislature Joint Committee on Public Health at the Statehouse. She said at her hearing, "Simply having less patients doesn't make me a better nurse." She continues by saying these ratios would override our professional judgment. And I can see where she's coming from. I hear you, Meghan. I understand why you feel the way you feel, but I'm in the camp. It sounds to me like your argument is safe patient ratios or healthcare provider, nurse, professional judgment. I'm in the camp of and, right? I believe that we need both the safe patient ratios and our professional judgment. And when I go to work, there is no set limits where I work. We are not unionized. And yes, I do live in Massachusetts. But we do 90% of what we do is based on professional judgment, right? So our charge nurse knows all the patients on the unit, and they will decide what would be a fair a fair assignment for each nurse. When I go to work, it's not you just have patients room 1 through 4 and those are your patients. You don't have patients 1 through 6 and those are your patients. Nope. I'll go into work, I'll have patients in room 2, room 36, room 27, and room 15. Reason? Because their acuity levels all are at a certain level where if I have the 4 of them, I will be a successful nurse for that day. Yes. Professional judgment, I would say, is more important than just having a number and saying that this is the set number. You can't have more, you can't have less. That is ridiculousness. If that was what we were working for, if that was what the Nurses Association was pushing, I would agree with you. But that's not what they're saying. They're saying let's have a limit to how many patients you can have, and then once that limit is set, you do you, your charge nurse, your unit, your supervisor, you guys use your professional decision making to make the judgment, right? That's at least how I believe. And I just wanted to put that out there. I am all for it. And let me just give you a little bit of context before I end this. So this issue has pitted the Nurses Association against Massachusetts Health and Hospital Association. The two groups have been competing studies supporting their positions. So the hospitals have a study saying that the mandate would increase costs by nearly $1 billion a year statewide. The nurses say their survey found 77% of nurses say they have too many patients to give careful care. So how are we looking at this? The hospital are saying this is going to cost $1 billion every single year, and that makes sense. If you have a limit to how many patients a nurse can have, that ultimately leads to hiring more nurses. Nurses are not cheap. Nurses are expensive, but nurses are necessary. And nurses that do correct high quality care for their patients is necessary. Yes, the $1 billion is a huge hit, but I am in the camp that preventative care, that quality care, at the end of quality care leads to a healthier lifestyle for all patients and nurses alike, which would lower the cost of healthcare dramatically. Safe patient care coming from nurses equals healthier human beings, which equals less money getting funneled into healthcare. I think in the long run, in the short term, yes, $1 billion a year is extraordinarily high. I think in the long run, though, having safe patient ratios is much cheaper. That is my point of view, but I did want you to hear from the other side. Meghan Aldrich, your voice has been heard. You are an important human being in this conversation. I appreciate you going out and opposing something the majority of your colleagues are pushing forward. I think you're brave for standing up. I do disagree with you, but I'm happy that you took a stand and fought for what you believed in.